I'm often asked now about a preventative or prophylactic mastectomy. This has been particularly true since the Angelina Jolie story. What are the indications for a preventative or prophylactic mastectomy? What are the circumstances that we might end up recommending it? Let me share some information with you about that subject. A preventative or prophylactic mastectomy means removing perfectly healthy tissue. Why in the world would we want to do this? Well, there are certain circumstances like Angelina Jolie that make a lot of sense. If you've got approximately an 80% chance that you're going to develop breast cancer over the rest of your life, then trying to get rid of that tissue up front before it ever becomes cancerous is a good idea. But there's a really important caveat here, a really important point, and that is, even with Angelina Jolie, there is no breast surgeon on the planet who can say that he or she is removing 1,000% of all normal breast tissue. Clearly, we're removing everything we can see, touch, and feel. But at the microscopic level, breast tissue can occur from the armpit all the way down to the upper abdomen. And if you'll recall with the Angelina Jolie story, she correctly said, my chances of dying of breast cancer have been reduced by 95%. Notice she didn't say 100%, because again, nobody can say that 1,000% of all breast tissue has been removed. Now in the last 5, 8, maybe up to 10 years now, women are coming in and asking me about preventative mastectomies. And I'm talking about women who are not gene positive. Usually, not always, but usually these are younger women, sometimes in their mid to late 30s or throughout their 40s, who say, I've got a cancer on this side, I never want to go through this again, and I want the other side off. In my practice, I don't generally recommend or even suggest a preventative mastectomy unless somebody's gene positive. Then I think it's an important conversation. But if I'm just treating a cancer on one side and the patient then asks me about a preventative mastectomy, almost always it's covered by insurance. And I will discuss with her what are the odds of the cancer coming back in the other breast. But one of the things I really understand is her fear and never wanting to go through this again. I understand that clearly and I honor that fear. And so therefore, what I want to make sure of is if we're doing a preventative mastectomy, I want it to look as good as it can. If she wishes to have reconstruction, that's why I've been such a big fan of nipple-sparing mastectomies. So preventative mastectomies, I think, are clearly an important option when you're gene positive. The gene positive patients can be followed with mammograms and MRI regularly, but it's certainly a legitimate option. And if somebody brings it up because they've got a cancer on one side, I fully discuss the option with the patient.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
About personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.